Hi everybody, and welcome to my pitch for the Young Medical Delta Thesis Awards 2020. I am Charlotte Kemp, and I did my thesis about the design of a needle control device for MRI-guided interventions. First, I will tell you a little bit why I did something for MRI-guided interventions. In regular surgeries, you have a really hard time, the surgeon has a really hard time in finding the difference between, for example, a tumor and healthy tissue when it looks a lot like each other. You only have your own vision and your sense of touch. But sometimes this is not enough. So in an MRI guided intervention, you don't have that problem because um, you can see clear distinction between tissues because of the imaging techniques. This is especially comes in handy when you do abdominal surgeries because the patient is breathing all the time and it also moves. Or for example, brain surgery, because when you lift the skull, the brain sags in a little bit, and then you don't really know exactly anymore where the tumor is, especially when there's not a clear distinction between tissues. This is really hard to see where your target is. So when there is a clear distinction between tissues, there's a way higher accuracy because you know which tissue you have to treat. And this also could result in a higher success rate for interventions. Something else that I incorporated in my thesis was path determination. With MRI-guided interventions, and when the process is automated, you can see where the needle is and you can see where the target is, and you can make a clear path or the fastest path to that target. In a normal surgery, the surgeon has to search for the target. So there's a lot of internal damage, and this is not the case with path determination. So minimal internal damage, and therefore also a fast recovery time for the patient. Well, these advantages I used I really wanted to use to do my thesis, and for that I designed the needle control device. Here's a schematic view of what the layout looks like. So we have the needle control device here on the right, which is kind of glued to the patient, and the patient lays on the MRI bed and has to go inside. There's also the physician and the assisting medical staff. And then on the other side, you see in the control room, the laboratory technician with the control unit. And I must say the complete device, so the needle control device and the control unit, are all from plastic. And it works on a motor of hydraulic pressure. So it's totally MRI compatible. And it works with air pressure. So what it does, it's all in the title, it controls a needle. And that needle can be anything, and as long as it is flexible and it has a pre-curved tip. So it could also be a catheter, a wire, just everything as long as it's flexible and has pre-curved tip. So the needle control device is glued onto the patient, it grabs onto the needle, and the patient is being inserted into the MRI. Then the physician and assisting staff draw back. They determine which path to take, and they do the intervention. And that's it. What I did for my thesis is the design of the control device, of the needle control device, which you see here on the left side. This is just an image of and a look and a feel of how it should be. And then on the right side, you see the prototype that I made. For the prototype, I really focused into the working mechanism, and unfortunately, I cannot show you that because it's under embargo. But it contains a lot of gears. And as you can see, it also runs on stepper motors, just regular stepper motors with metal. So we did some tests in CT scanner, but it was already really promising. If it wasn't for the Corona crisis, I would definitely start a spin-off, but the circumstances were different. So right now I have a regular job, but who knows in the future, you know? Okay, thanks for listening, and and thank you. Bye.